So while we're waiting for everybody to come on, I just want to welcome everybody. I'm Allison Muccio with the Boca Chamber. I think I know most of you that are on here. As you can imagine, having Brian on here, this is a pretty popular event. Thanks to Allegiance Home Health for bringing this to us. I don't know, I guess this is the perfect thing to do on kind of this gloomy morning, this gloomy Friday morning. But we're just happy everybody is with us. And what I would love to do is have Rosie, who has been our sponsor since the beginning, just say hi to everybody and tell you a little bit more about what she does and who she is. So Rosie, I'm going to turn it over to you.
Good morning, and thank you. Thank you, Allison, and thank you, Brian, for speaking today. We're so excited to hear you. My name is Rosie Nguanzo Martin, and I am the CEO and president of Allegiance Home Health. My husband and I owned a physical therapy clinic in Boynton Beach for 13 years, and back in 2005, we opened up Allegiance Home Health. We opened it up because my mother had medical issues, and we were not satisfied with the home health that she was receiving. And we thought that we could really make a difference, protect seniors at home and any retirement community. And we have been very successful. We're a 5-star Medicare rated home health agency, award winning. We have been awarded Home Care Elite for the last 11 years. We're very proud of that. We have very compassionate caregivers. So we provide physical therapy, occupational therapy, speech therapy, nutrition, and social services in your home, as well as private duty services. And those are CNAs and home health aides. You might see them maybe at Publix with an elderly person, and they're helping them shop. They're doing meal preparation, light housekeeping, keeping them safe at home. And thank you, everyone. And I wish everyone a wonderful, brand new January 2021 New Year.
Thanks, Rosie. So this is going to be more of a discussion presentation, which I think is awesome. And that way we can get as much information out of Brian before he leaves us. So let me go ahead and introduce Brian, because he has quite the bio, and I want to make sure to get everything in. Brian Altschuler serves as the Vice President of Ancillary Operations with Boca Raton Regional Hospital. He is responsible for overseeing many of the hospital's operational functions and acts as a liaison to the Debbie Rand Memorial Service League. He's been with them since 2007, and as you know, Boca Regional is now part of Baptist Health South Florida. Prior to joining Boca Raton Regional Hospital, Brian played an integral role in leadership and staff development at both Palms West Hospital and Bethesda Healthcare System. He also spent 10 years with Marriott International in various operations and support positions and at Walt Disney World Resorts. He received his Master of Science in Management with a focus of leadership from Nova Southeastern University and is an adjunct professor at Lynn University. He holds certifications in Situational Leadership and Development Dimensions International. During his career, Brian has earned numerous awards and honors, including the 2004 Palm Healthcare Foundation's Commitment to Community Award and the 2008 Human Resource Association of Palm Beach County's Human Resources Professional of the Year. In 2013, under his leadership and innovation, Boca Raton Regional Hospital's Human Resources Division was named one of the best human resources in Palm Beach County. His most recent honors include the 2018 Excellence in HR Award from the South Florida Business and Wealth magazine and the 2018 Wellbeing 100 Award from the Corporate Health and Wellness Association. Brian is an avid cyclist and enjoys riding around the city he calls home, which is Fort Lauderdale. Prior to the pandemic, he loved traveling by air and sea, exploring new cultures and places. His hobbies include photography and discovering new off-the-beaten-path restaurants with amazing food. I'm with you there, Brian. Without further ado, I'm going to turn it over to Brian.
Well, I certainly, Allison, Rosie, and Chastity really appreciate the great introduction, and I appreciate everybody going around and introducing yourselves. if you've, it's still funny though, I can't get used to hearing my bio, right? I'm so used to talking about other people and putting that energy forward. It's still always humbling to sit back and listen to your accomplishments. And then you also start going, now I understand why my hair's a little gray. That it's been several years of doing a lot of fun, different things in the community and in my professional business career. I want to kind of start off with giving you a little bit of a background on myself, because some of you have known me for a while, but my role has really evolved here at Boca Raton Regional Hospital, now part of Baptist Health South Florida, and we're really proud of that, and we're proud of the umbrella that we're under with Baptist Health of South Florida. We've joined 11 amazing hospitals and numerous ambulatory services and different facilities throughout South Florida, all the way down into the Keys and growing up here in Palm Beach County. So it's really been an interesting journey for me. Many of you know me specifically from an HR background. Some may know and some may not know. It's coming up on about 5 years now. But I had an opportunity when we were a standalone hospital to get promoted as one of our administrators for the hospital as a vice president. And I primarily kept my HR role at first. And as things kept evolving, and it's what I tell people, and we're going to talk a lot about COVID in the workplace today, but I want to give you a basis for how I kind of approach things and how I think things have been working very well for us. I always say to people, when others say no, you should say yes, and you should really put yourself out there to help be part of solutions. And starting as an HR person, one of the biggest things that gets interacted with everything, including COVID in the workplace, is people, right? So when you have an HR background and you can really tout the ability to work with people and come up with a lot of people solutions, you can really kind of build on that. Through my Marriott days and through my Disney days in hospitality, I also did a lot of operational work. So when the opportunities came up in healthcare, I was able to really kind of not only take my HR people background, but really take some of that operational knowledge and execute on that as well. So it was really kind of a nice balance. I have a very eclectic kind of career. So today I sit as Vice President of Ancillary Operations. Actually, just recently, as of January 1st, my role evolved again, which I'm very fortunate and feel blessed about, where I'm now helping to be the administrative arm to some of our clinical areas here in the hospital. So I now, during COVID, a very busy time, help oversee our pharmacy area, our respiratory area, and our EKG area. So it's really allowed me to continue to grow as an individual. Some of you may or may not know, but way back, I actually started in a volunteer rescue squad and had a little bit of a time period where I really did a lot in the EMS community, and at one point even thought I wanted to be a police officer. And worked for my hometown police department as a dispatcher, a 911 dispatcher. So I took all that, and here I am several years later, sitting in a great seat, helping to really be part of a very challenging time for us all, really, no matter where you kind of are positioned with COVID. It really has changed things, right? So if we go back a little bit and go back to thinking about March of last year, how many of you honestly thought we'd still be talking about this here sitting in January of 21 when this happened in March? Most of us thought, wow, this is going to go on for like 60, 90 days. We're going to have to like do this quarantine thing. My God, what's happening here? But this will pass pretty quickly. How many of you honestly thought we'd still be talking about this today? Probably not many of us, right? And even myself, I have to be honest, I thought originally, okay, this is going to go on for a little while. Maybe this will, as we were progressing and you saw things kind of spike and peak and have different valleys and kind of go through this time period, right? You thought, okay, well, maybe this is going to be more to the summertime. And then we said, you know what? Nope, we gotta be honest. This is going to be a vaccine thing. We're going to have to try to go through, warp speed and try to get something developed and get it out to market in a safe manner. While taking care of people, and maybe by the end of the year. And now we're really learning as we go into 2021, and I'm really looking forward to a very positive year, that we have reached a real milestone where we have gotten this vaccine to market. with, almost right now, I think about 3 major manufacturers, right? We have AstraZeneca that's doing stuff in Europe, and developing with Oxford, and has been approved there. And we have the Moderna and we have the Pfizer vaccine that are also being used around the world and heavily here in the US. So right around the end of last year, not only in my role did we start, looking at vaccination and how we would set up vaccination sites to get our employees vaccinated and start participating in community planning, but we were still running what I kind of consider buckets, right? We're still running a normal operation in the hospital. We're doing vaccine planning, and we're dealing with a COVID operation, kind of like a mini hospital within a hospital, because some of you may even have questions on how do you keep everybody, safe, and how do you, look at your different patient populations. So we can even talk about that, because maybe that has some impact on how you think about your workplace, or Joyce, you even mentioned your condo. A lot of the things I'm going to talk about today can be applicable in a lot of different settings, which is really why I chose to keep this a roundtable discussion, because what I will commit to is, depending on where the conversation flows to and what I hear some of your major concerns are, is I've committed to Chastity that'll put together kind of a summary sheet and send it out after. But one of the things that I prefer when we're on Zooms is not to really do a lot of PowerPoints, because people are looking at screens and not necessarily being engaged. And I want to make sure that we have a very engaging conversation, because it's an important topic, and we want to keep people safe in the workplace, and we want to do things the right way. So just back to the hospital for a minute. So in January, we start, at the end of December, start really looking at vaccination and the reality that we'll have this available to us here in South Florida. And with all these different buckets that we're dealing with here at the hospital, you can imagine, we're dealing with a lot of people, right? We're dealing with patients, we're dealing with their families. We're dealing with employees. We now have nearly, in our single hospital here for Baptist Health South Florida at Boca Regional, nearly 3,000 employees. So when you have that many people in your environment, whether they are here on campus or remote, because we're going to talk a lot about how even in healthcare that has very traditionally been a front-facing kind of industry, right? You got to kind of be here if you're clinical, for sure, right? You can't take care of patients via Zoom. And some may or may not realize we have huge back of the house operations that do anything from scheduling patients to the latter end of billing out for our services. So it is very multifaceted, very complex group of 3,000 employees. And we really have been a pretty, again, traditional industry, right? We've really looked at things, pretty much as a front-facing industry. The other piece of healthcare, as surprising as it sounds to you, or may sound to you, is healthcare in certain aspects has been amazing on the technology front, and in a lot of aspects, way behind the 8 ball in the technology front. And one of the things that, even looking at it more from the workplace environment, I find as a human resource professional is, in full transparency, even us here at Boca Regional, while we have a lot of great technology and a lot of great systems, from a workplace environment, we were really set up for people to come to the campus. We were set up for people to work here, work in Boca Raton. So when all this happened back in March, we really had to kind of put on a different mindset and really work with our technology folks, not only here on campus, but also down at corporate in Miami, to really determine how we prioritize and how we get people working in new and different environments, keeping in mind social distancing, keeping in mind, we were asking people to wear masks, which again was a new thing for a lot of people. And, people were uncomfortable wearing them for long periods of time. And we were dealing with a lot of these different issues, certainly dealing with people getting sick at that point, and, other people concerned about, becoming sick. So you have a lot of those perceptions and different things that start happening as well. So how I'm going to do this morning is I'm going to kind of talk about this in a little different ways. I'm going to talk a little bit about our clinical professionals. I'm going to talk about our non-clinical professionals, kind of break it up a little bit that way. I want to break it up also into talking about environmental factors with COVID in the workplace. And I also want to try to talk a little bit, obviously, about technology and some of the things that we have put out there, since I mentioned that already this morning, because technology is actually really working in our favor here at Baptist Health South Florida with keeping people safe. And some of the things that you're even hearing about, and we're not at this degree yet, but we are actually using applications on our phone to keep people safe. And our application doesn't do this yet, but some are even tracer kind of applications where you can kind of identify where maybe an exposure has occurred and how to prevent other people from getting sick. We're still kind of doing that on a manual basis, but our technology is evolving every day. And some of this app work that we're doing through our occupational health group, which I sit as liaison for on a lot of these different things, it's very promising. I'll talk a little bit about that today as well. And then we'll talk about some other pieces that might be able to help you a little bit with COVID in the workplace. So please do me a favor, as we keep this a little fluid, feel free, like Chastity said and Allison were mentioning, to use the chat, to ask me questions. If I'm moving past something that you're interested in too quickly, just let me know. We are being recorded, so I'll remind you of that, because the good part is while we all have crazy schedules and are doing different things, so one advantage to Zoom is a lot of people go back in the library and look at this later. So, again, I invite you to be as engaging with it as you can, and stop me. You don't need to wait till the end or whatever you want to do to ask questions. So I'm going to, again, stay pretty focused on the workplace, but try to include some of the other tidbit things that we've done here as a healthcare system. You can imagine, as a healthcare system, right, we're not only providing great care to the community, but we are always trying to set the example with our employees, right? So as a human resource professional, it's a little bit more challenging, right? It's hard to tell the community, you need to wear a mask, you need to practice social distancing, we need to create work environments and do this for our employees and not do it yourself as the person providing healthcare for your community. So we were very fortunate. We brought a lot of our experts together here at the hospital. And when this was really starting to evolve, we're tight on space here at the hospital. Many of you know that we're about to go through a major master facility plan expansion. So today, when somebody says to me, as the individual, again, responsible for space and storage allocation and looking at how we're going to put people into these spaces, we have 10 people in a very tight space. And now with COVID, that doesn't work. How are we going to figure this out? We had to act pretty quickly, right? We had to kind of figure out who absolutely needed to be here on campus and who could potentially go and work remotely. And it sounds really simple, right? You have two groups. You just say, okay, some stay here and some go home. But what you really have to realize is when you do that, and again, in healthcare and probably in many of your environments, in fact, I'm looking around the screen and I don't really think there's probably anybody that's not concerned about security when you send employees remotely and how they access your networks and how they get into your business and protected information. So that became a whole new thing that we had to kind of rapidly work through. While we certainly had laptops and certainly had that technology in place, if you're looking at reducing your capacity, and if you remember, a lot of the time the numbers that are being used are to try to reduce your capacity by half. A lot of times we're using that 6 feet distancing, make sure that it's minimally at 6 feet. All those pieces kind of, come into play at the same time. What we also looked at in a lot of our environments is not only that distancing, but we had to start looking at, while we believe, and we've always been a very clean facility, and we've been recognized for that. When the CDC and our corporate headquarters in Miami start putting out new guidelines for cleaning, it just doesn't mean our public spaces and our patient spaces. It means everything for our workforce too. So we had to figure out very quickly with the resources we have, and we have our own departments here at the hospital. We have our own environmental services departments, and we're fortunate that way. And we have our own facilities department, and we have our own construction department. For many of you, that's bringing in vendors, right? That's bringing in resources from outside of your core business. And I've spoken with a lot of people. They've called me individually. I've spoken to environments from typical business offices to physician offices, and really working through giving them some suggestions pre-COVID kind of exposure, and when they've had an exposure, how to kind of deal with it and work through that and make sure that people are getting what they need. So we did a lot of assessments, and that's where you have to start a lot with the environment, right? You have to go into your businesses and really look at your workplace. Some of you are probably very fortunate and maybe you're in more modern environments that allow more open, interactive spaces. In a lot of those circumstances and some of those areas of the hospital that we have, I found it a little easier to modify those workspaces versus maybe more traditional spaces where, like, for example, we have a call center and they're basically set up in either 5x5 cubes or 6x6 cubes. And it's an open air environment. So even if you have an open air environment like that, you have to start thinking about air exchanges and even not just social distancing, but are your HVAC systems functioning to their optimum? Is there any modifications that need to be made to potentially keep your environment cleaner and safer from that airborne perspective? So a lot of things really that aren't as simple as saying half stay and half go home, right? One of the other things we learned very quickly with COVID in the workplace is for those that we're sending home, how are you sending them home? Are you giving them the resources they need to be able to do their jobs remotely during COVID? And while that sounds like maybe that's just giving them a laptop and technology, what we found is, and I'm sure many of you have this too, we have a lot of folks that might be single parents. And at the same time, you got to remember, and even now, right, a lot of kids are still doing school remotely and or in a hybrid situation. And even if it's a two-parent family, a lot of times people are juggling how to manage that school experience, that work experience. And some people, like I said, could be single parents. Other people could live in an environment where maybe they're in a one-bedroom apartment. I've had employees that are in studios and will say to me, hey, Brian, I've got to be able to now set up a desk. I've got my kids in one part of the apartment. I'm in the other part of the apartment. How do we work on different solutions, to make sure that we're keeping everybody healthy and safe and productive? So, I'm giving you a scenario of understanding there's a lot of different things that we had to address very quickly for everybody. So we brought this team together and we had kind of a subcommittee that focused on, and you all can do this too in your workplaces, right? Whether it's you have the resources internally or you bring these people in externally. But we brought people together to really assess the environment, to determine with use of distancing, with use of, we did a lot of work around using plexiglass. We put a lot of partitions like you're seeing in restaurants. It's funny if you go into a lot of barbershops or hairdressing shops, you'll see they've actually put stanchions on floors with plexiglass. We've evolved a lot of different ways to keep people distanced and reminded to be distanced. So we modified a lot of our workspace. What we did too with the environment is we really did try to reduce our capacity in the hospital for anybody that does what we call back of the house functions. We learned through COVID, and it's something we're still evolving with, that many of the employees we thought needed to be here on the campus could actually function and do very well remotely. A lot of leaders were concerned with productivity and monitoring productivity and doing all that. And I'm very pleased to say I've heard very little back to the contrary, that everybody's really been very functional and working very well. We've even been able to do that with some of the environments that we originally thought would be challenging to do that with call center environments and our patient scheduling areas. But we've been able to rotate our team members in and out of some of the areas on campus with giving them remote capability of setting up technology, giving them headsets, and having them work elsewhere through secure environments back to our network. Some of that's just a reality. You can't always keep everybody in the office. Yep, go ahead, Allison.
Brian, Wendy Rosenblatt wrote, do you think it's fair that people are flying to South Florida and receiving the COVID vaccine when so many eligible people can't get an appointment?
Yeah, and I can certainly comment on that, and I will. Remind me and I'll comment on that as we kind of I talk a little bit more about vaccine and how that's impacting the workplace. And some people may even be curious whether or not you can mandate people to do that, to come back to the workplace or other things. So we can kind of talk a little bit about that as well. But just sticking with the environment just for a minute and making sure that I give you some of the solutions that we did. We did things too where we modified cubicles. So not only did we use plexiglass, but there are different, some of you may realize this or may not, but there are different heights on cubicles. There are ways that you can modify cubicles. We partnered particularly with our hospital with Office Depot here locally in Boca Raton, but work with their furniture division. And we worked through several departments like our case management department. Those folks all needed to basically be on campus. So what we did, and again, I'm going to kind of go between the environment and the people perspective on this. You know, our case managers help manage our patient care plans. They help do our discharging. They need to be front facing with our patients, and they need to be here at the hospital. So we really needed to keep that whole team here. We literally, without a lot of expense, did go in and really modify their work environment. We not only modified where they work in the office area, where we gave them more social distancing, did a lot with plexiglass. I actually modified some of the cubicle heights because their cubicles faced each other. Maybe some of you have environments where in the past you wanted your team to be able to see each other and interact more. Well, we were able to modify some of the work environments where we gave people more comfort that they weren't face-to-face with somebody else. And as simple as like a cubicle modification, we're able to keep them here working. Again, through just making sure we worked with our HVAC teams and made sure that we were getting the right air exchanges in offices, brought comfort to people, really showing them that we were being proactive. And that's one of the things I would stress when it comes from the people perspective. The more visual and the more communicative you can be, and making sure that you're actually providing them with ongoing communication on what you're doing. We put in, like I started saying earlier, new cleaning procedures. People don't necessarily see you clean. Sometimes they can, you know, see it in the morning, you know, the trash is empty, that kind of thing, but they don't know if you're wiping down the phones, if you're wiping down the desks, if you're using the right chemicals or cleaners. We haven't probably given this a lot of thought in the past, right? You know, nobody thought of cleanliness like we do now with COVID. When we talk about people and environment, I would really stress to you to make sure whether you're using a third-party service to clean your spaces or working, you know, internally, somehow you have those resources, that you're using the right things. You know, we use a chemical called oxicide that's safe for people to make sure that it's the right, you know, chemicals to kill germs and to keep viruses under control. We actually were one of the first hospitals for Baptist to institute the electrostatic kind of cleaning with the foggers. And right now I think I have 4 of those deployed here throughout the hospital and some of our ambulatory areas and throughout the hospital. And we have individuals that just go around and fog our patient areas, our waiting rooms, our employee work areas at night, and do those kinds of things. We've instituted ultraviolet cleaning here at the hospital. We were actually, even before COVID, using 2 ultraviolet robots as Boca Regional before we joined Baptist. And because I was having a lot of success with ultraviolet cleaning, it's simply technology that you can put in a space, you evacuate it from people for the time being, and run these ultraviolet lights that have great results, and also, you know, killing, you know, any sort of surface concerns. So between fogging and ultraviolet light, using the right chemicals, having the right regular cleaning processes in place, we've really been able to not only strengthen our environment, but really help give our people a sense that we're definitely concerned about their well-being, and we want to make sure that we do everything we can to keep them safe. And we get a lot of good feedback on that. So yes, please.
Hi, Brian, Rosie. So at Allegiance Home Health, we have, like you, we found that our office staff, we VPN'd really almost 75% of them. And we were also worried about how it would work. And it's actually been very successful. And we find that they probably, believe it or not, have less interruptions because they're able to focus, and they're able to do a lot more. And so we've been very pleased with that. Have you thought about re-entry into the office space when these employees that have actually been successful working at home, how are they? Are you putting them back into the office space, and when do you think that would even happen, or would you keep them working at home?
So you bring up actually a great point, Rosie. You know, as an HR professional, you know, some of you may realize this and may even do this yourself. We tend to see here too the folks that we've sent remote. are actually, where the concern originally was, how do you monitor productivity? If you ask many of them say they log on very early in the morning, and we can track some of this too through our network, right? So you can see, what they're doing, and especially call center environments, all these kinds of things, right? And even I'll speak, for myself, and I know on just office environment. If I'm ever home officing and doing anything, you're usually logging in before you generally be at work, and you're usually going even longer when you normally would shut down in the office, start commuting home. So we've actually seen some people, in a lot of cases, be more productive. You bring up a great point, because we actually are at that point where we've been able to modify a lot of our workspaces. And while we are truthfully really going to continue with a lot of the best practices that we've discovered through COVID, where we may keep some people who were traditionally here on site remote. I'll give you an example. We're talking about COVID in the workplace, and as a human resource professional, we had 100% of our human resource team here on site. What we are probably going to do is continue to rotate those individuals in and out, where basically on a 2-week period, they'll be considered remote employees, but be brought back into the office just to engage with each other and kind of have these touch points to make sure that we keep those teams united from a workflow perspective. So there'll be a little bit of a hybrid piece on that. But as far as from the safety perspective, when we're starting to bring more and more people back to the campus, obviously, especially now with the new strain and everything else, and we're trying to balance all these kinds of things, we are shifting our thinking, where we are really making sure that we're providing, the most optimum environment and not overpacking offices, because even with that 6-foot social distancing, we really are asking people in open air environments to wear their masks during the day. We're not just allowing people to come back into the work environment. So even in your case, Rosie, if you're all in the office, our recommendation generally is, if you're in an open air environment, even if you're kind of in that 6 feet range, we're requiring our employees to wear their masks. So what we're trying to do is use areas that have stayed remote and expand. Like, let's say you were traditionally on one floor. If you're bringing more people back, what we've done is we've kind of split departments to try to, again, minimize the number of people in one area or one space. So, you can do that a lot of ways, right? We have the flexibility. I can move people to different areas. I just have more space. Even though we're tight, we still can do that. In your case, if I'm thinking about where your office is, probably my biggest solution to you would be to rotate people in and out, because not everybody needs to be there every day of the week, right? When we're thinking about COVID and people, one of the things I want to share with you, because I think this was really, I appreciated it, right? When my leader basically said, you know what, we have, roughly 6 administrators. Do we all need to be in our office space every day together? What if somebody does get COVID and brings it into the office? If we're all on top of each other every day, we have a hospital to run. So when the vaccine wasn't available to us prior to December, we're really focused on how do we even schedule ourselves differently? How do we make sure there are some people here early? How do we make sure some people come in later? How do we make sure that somebody ebb and flows out of the office so that we reduce capacity? So with your environment, Rosie, that's probably very doable, right? Some people can be in the office Monday, Wednesday, Friday. Others can be in there Tuesday, Thursday. Some maybe don't need to be in there. So when you talk about people, scheduling is really a big thing. Surprisingly, when we talk about scheduling too, and this hasn't been as recent, but I had some of this, and leaders would ask me, how do I resolve this? But people did have different perceptions on being sent remotely, right? If you said, I'm going to keep some people in the office, I'm going to send some people to work remotely. When we originally weren't at the point of rotating people like we are now a little bit more for those that are coming back on campus, I did have some people say, how come, Maureen gets to work from home and I still have to come to the office? We had that from, the supervisor level. We had that from the line level. Why is this okay and that's not okay? Because you start having some different practices, right? And you want to be careful when you have different employment practices. You want to make sure that as a business owner, as an HR professional, whatever your capacity is, that you can justify your decisions, right? That you can always have a business reason to why you've made that decision from a people perspective. So I always encourage you to think about that too, and make sure, You know, equalness is a very funny word, right? I always try to make sure in a human resource capacity, I use the word equity. We try to make sure that we're treating you with equity. Just because I do this for Allison doesn't mean that's the same thing I'm going to do for Michael. There might be different reasons to do different modifications. Michael's job might be easier to do remotely, where, you know, Allison's job requires her to do more here at the hospital, or vice versa, right? There are ways to kind of do that and look at a schedule and look at why you're making those business justifications. But you should always have that. You should always put some thought into that piece. I want to talk a little bit of, yep.
Brian, before you go on, I just want to, Barbara Cambia wanted to know can you require individuals to come into the office, even if they can do their job from home? Because she said she needs to have people in the office. They're open and she needs people there. So what do you feel about that?
Yeah, so, you know, when you're especially a private employer, right, it's sometimes, you know, there's differences, obviously, and I want to stress that between being a private employer and a public employer. And I also need to stress to you, I'm certainly, while I'm very confident and very proud of a lot of my accomplishments, one of them is not a lawyer. So I would always say to you, you have to talk to your general counsel. You have to seek your outside counsel if you don't have that, to make sure that you're doing everything you need to. And some people have more of a comfort and more of a you know, environment where they're able to do more. So I just preface my comments with that. I'd be very careful about, you know, saying to somebody, you know, I want you back in the office tomorrow. What I would do again is help them understand why you need them back in the office tomorrow. And if you have a business need, and I go right back to that same thing, you know, in Barbara's case, I know Lynn, right? I'm adjunct faculty there. Barbara does the career office for there. Barbara may not need, again, every day, all hypothetically half a dozen folks in the office there, but she's got to run a reception desk. She's got to have people there to interact front facing with the students who are graduating and doing different things. It's a function of the job. So I would go back in her case to the job description and what that person does, right? You always go back to the foundation of why you're trying to make your decision. And I understand why Barbara's trying to make that decision. She needs people to guide and help folks through. So, you know, it's let's talk about an HR department. You need somebody in HR to go ahead and greet people, right? You still have, you know, while we don't have a lot, we still do get people that show up here as applicants and want to get on a computer. There are groups of, you know, socioeconomic individuals that may not have computers at home. So we're still obviously open. We have to have somebody there to help provide access to computers. So if my reception here would say, I don't want to come to work while the majority of HR is remote, we have that person coming to work. We're providing a clean, safe, social distanced environment. We have plexiglass up on the desk so that when she is front facing with people from the community, she's not in direct contact with them. So we've done all those things to make sure that she's safe. So in Barbara's case, I would, again, talk to her general counsel if that's necessary even, and say, hey, we need people in the office. And what I'd probably do in her case is maybe consider a rotational schedule. And, you know, or if there are key positions that are just required to be there, we do it here in the hospital. We're a private employer. I can't have a nurse working from home. We have to have nurses. We have to have CNAs. We have to have our respiratory folks here. I have to have pharmacists here. It's the job description. It's their job and the role you signed up for. And so I would really tell Barbara that she wouldn't have too much of a problem saying to somebody, I need you in the office. And again, I'm sure we can all agree it's how you say it and how you involve the person in that decision process and helping them understand it. But the reality of it is if Barbara needs them in the office, I'm sure her general counsel would agree that they would need to return to the workplace because that's a function of the job. Is that clear? Did I answer Barbara? Joyce.
Hello, good morning again. Thank you, Brian. Great information. When we came on, I was mentioning that this also interested me because I'm on the board of an association. I live in a high rise, and these high rises are like cruise ships. If somebody gets sick, the whole building could get sick. Mm-hmm. And one of the things as a board member is trying to enforce these rules. People, like right now, we don't have pool furniture at the pool. then people are complaining. They take the furniture back from where we store it, they drag it, they bring it to, they put 2 or 3 together, they sit with their friends. One of the complaints is, you can't tell me what to do. I can do what I want. And what we hear from our attorney is, if somebody in the building gets sick, there's going to be a group of attorneys out there that are going to say, well, did your building do everything they said they were going to do? Oh, no, we have furniture at our pool. Well, then that's a place that they can go after and sue and say, well, you had furniture at your pool and people got sick. They might have got sick at the pool and they're in your building. And so there's that whole thing, because when you talked about lawyers, it reminded me of that. There's that whole thing of, how do we enforce some of these rules, not only in the workplace, but in our domestic? You know, this is a very difficult, touchy thing, because people feel that I can have guests, even though we have signs in every elevator and in the lobbies, no guests allowed. But people seem to think that it's not they don't want to wear masks. They congregate in the common areas, whatever. But I'm torn with that. So maybe you can comment on that.
So I'm going to comment quickly, Joyce, but on something like that, and again, I'll even apply it to the work environment. You got to look at your duty to act. You got to look at, did you have a duty to act and do something reasonable and prudent, right? It's the same thing in a workplace. You know, did you do the reasonable and safe thing for good reasons? So if you look at that example, you know, I live in a condo as well. You know, we reduced, and again, I use that 50% number. We reduced our capacity around our pool deck 50% to keep that 6 feet social distancing, even in an open air environment. If you have nothing there and that's what your condo feels is reasonable and prudent, and you got the best advice to do that, then you as a board or whatever, or as a business owner or whatever, have a duty to act in a lot of these cases to provide a safe environment, and however you feel that's appropriate with the guidance of your counsel is probably my best answer for you. So, you know, we require masks in our building, we require masks in our workplace. If you're not wearing them, you know, in our condo, believe it or not, they have a sign up that says you'll be fined. You know, we're allowed to use our pool area at 50% capacity. After that, you know, you're asked to, you know, not be around the pool if it's full. You know, our gym is limited to a certain number of people. You know, we're doing that here in the hospital. So we have public spaces where people eat together. And I should talk about this real quick, and I want to make sure I get to technology. If you guys have areas where you are feeding employees and doing stuff like that, you know, we've gone to closing down water fountains, any public sort of soda fountains, all those things that are like multi-use, coffee machines, things like that. We have gone to either where we have an individual that is serving from those devices, or we have gone to providing services that are more individualized, like, you know, box salads, where maybe there used to be a salad bar. Now you go to a grab and go and you get your prepared salad. So I want to make sure if you're doing any sort of food environments or things like that, the same things apply. We've reduced our table seating 50% in our indoor environments. One of the things that I did here on campus, and again, I had the luxury to do it, and it was a huge win, people really enjoy it, is we put all of these outdoor tables around our beautiful pond and around our grassy areas. And we have a lot of employees now also reducing stress during their meal period. So they get out of the hospital environment, and we have them around the campus in environments where, you know, they can get together with each other, be out in the fresh air and eat safely. So you have to think about all these, whether it's in your condo, whether it's in your workplace. There are always ways to modify the environment, and there's always ways from the people perspective to look at how you schedule, to how you have those good communications, to making sure that you're engaging the people in these decisions and the reasons for them. Even if you can't always make everybody happy, I generally find if you help somebody understand the why, it's a lot easier for them to get on board. They still may not like it, but they'll understand the why. They'll know why as a business owner or leader you're making that decision. So we've done a lot of that. I want to talk about technology real quick. Not only with the remote technology that we talked about earlier, and making sure that you're thinking about those things and try to learn from best practices. If there are things that because of COVID have worked, I encourage you, if somebody's working remote and it's working for them, maybe consider that. Is that the right thing to keep doing? Do you save on lease and rental space? All those are kind of things to think about. You know, it's one of the things that I found is really good is, like I was saying with the HR group, to make sure we still have our team connections with all those folks. They come into the work environment every couple of weeks, and the teams rotate. So we might have talent management in one time, we might have employee relations in another time, and they're always doing it safely, right? They're not all in on the same day. So consider that flex scheduling, consider that flexibility period, and look at what really might strengthen your business. Maybe things you didn't think about pre-COVID have become true winning solutions for you now. And as you consider bringing people back, if you need to bring them back into the live environment, I encourage you to do it slowly. I have a very good friend over at Poland Capital, and when they were looking at bringing their team back into their financial business, you know, I spent a lot of time, some of you may know Dan, he's a childhood friend of mine, and we talked a lot about, from an HR perspective, and also about environments and things that they have in the office, how to safely do that. One of the things I said to him is everybody doesn't need to show up Monday morning at 9 o'clock. You know, sometimes it's better to phase people back in. So I think, Rosie, you're also the one that asked me that question. I really encourage that. I encourage you don't just like say, everybody's back in the office on February 1st. I think it's really good to bring teams back slowly, make sure that everything you think's in place is in place, from cleaning, from, you know, even facilities, right? I'm talking about dining facilities. I'm talking about bathrooms. I'm talking about shared spaces, and making sure that you're not creating all of a sudden this surge where things weren't occurring for almost a year, or whatever the case may be. Phasing is really critical. I really do just want to talk about technology, because I told you about our app here, and I don't want to cut us too short on time, but we use an app here that's actually on the Virgin platform, and I'm going to bring this up a little closer. And believe it or not, this is started as our wellness platform. And on this wellness platform, through our technology group, they developed an actual COVID screening tool. So every day prior to coming to work, we answer a set of questions, or about 3 or 4 questions on this app that we answer, because we're trying to provide a very simple environment for our employees to be able to know whether it's safe for them to come to work. So you'll see mine today, thank goodness, shows a green check. There is also a red stop sign. And by answering this group of screening questions, it lets the employees know whether or not they need to contact our occupational health department. And it'll ask you things like, within a certain time period, have you had these X, Y, and Z symptoms? In this time period, have you been potentially exposed to anybody with COVID-19? You know, it'll ask you a series of different questions. Those are examples. And then it will assess your answers and give you either clearance to come to work or the ability to contact occupational health. When you get here at any of our access points on our campus, you are automatically subject to a temperature check. So we have actually put in place, and this is actually pretty cool. We piloted it here and it worked so well. We've rolled them out to all of our 11 hospitals, but we actually have scanners at our entrances. And the scanners validate if you are wearing a mask. This actual system can validate whether or not you are wearing a mask, and it assesses your body temperature at the same time. And it will either, again, show you clear as green, or show you red and direct you to one of our service, you know, individuals at our entrances, or one of our concierges to help do that follow-up with you if you do, you know, flag at red. We're very, very careful with who we let into the environment, including our employees. So again, you know, can you allow all those things? You know, as a private employer, we can ask people to participate in all these things. We can say, you know, as a condition of employment, we want you to do X, Y, and Z. As long as it's reasonable and prudent, you shouldn't have any problem doing that kind of stuff. So between the right environment, having the right communication, and the right processes in place for people. And somebody mentioned this earlier, and Joyce, I think you did. It's really important that no matter what you do, if you have a policy or a practice in place, that you follow it. So be careful what you actually put in writing and document that you do. Because if you say by practice or policy you're doing something, that could be challenged, right? So you want to make sure that if you're saying you're doing something, or it's in writing and you're saying it's a policy, you want to make sure you do that. So I've kind of on a very high level covered, environment. I've covered some of the people components, both in office and remote, and some concerns. One of the things I'll share, when we sent our people remote, I'm really proud of Baptist actually. When we sent our people remote, not only did we make sure that they had our technology, and I should stress that, even if they had computers and stuff at home, we, at least in our case, required them to have our technology and use our technology. But we also gave them a stipend. We gave them, I want to say it was $200 to be able to set up their home environments and make sure they had what they needed to get set. We allowed people to take, if they had their favorite desk chair in the office, you want to talk about easing the transition, we allowed them to take their favorite desk chair. And by the way, I'm allowing them to bring back their favorite desk chair. Really consider how you do this. It's not so one way or the other. We really try to have a humanistic approach to how we did these things to try to make things a lot more comfortable, whether they were going out of the office or now if they're coming back into the office. Remember that phasing being a key word, and really making sure that you're using some of the best practices out of COVID. Plexiglass is our new favorite friend. That tends to work really well. Just looking at my notes to make sure I covered all the key things I wanted to. We have a few minutes left. I'd like to stop talking and just answer questions. Yep.
Brian, I've heard of the plasma donors and experimental treatments like Regeneron, and I'm just wondering if the hospital is doing anything like that.
So the answer is we're doing it. So again, you can tell I'm really proud. We're doing all of it here. So we are doing that by appointment, by physician, obviously order, through a separate area in our outpatient emergency department area. We are currently, as of December, providing vaccine here at Boca Regional. I believe, Michelle, I can safely say this. Currently, while we are not a public site, we are working with the county and the state diligently to become a partner, not in a month, not in a long time, in the very near future, on being a business partner and helping our community here locally in Boca Raton try to set up a pod. We have been doing that in the Miami market with FIU and at our own managed Hilton down in Miami. I believe last week, Michelle, keep me honest, we had 13,000 appointments that we opened up in the Miami market, and up here in Palm Beach. Again, while I can't announce a specific date, it is in the very near future, and you'll be hearing about that shortly, where we're trying to expand our piece here. Right now, we're averaging on our campus between our employees and healthcare providers and key frontline people, giving on average of about 350 to 400 shots a day. Monday through Thursday. We take Fridays to kind of regroup right now. And in February, we'll even be going to 5 days a week on our site here. And then Michelle, I don't know if you want to say anything about our partnerships, but I know we are very quickly trying to do that. Somebody asked me also if you can mandate vaccination. So again, I'll use I didn't forget, I wrote that down here. I was going to get back to that.
That was my next question. I'm going to put myself on mute.
Yeah, so, I will use us as an example. So if you talk about the flu shot is an evolved, accepted immunization that has been out for a very long time. As a private employer, and again, I always go between private and public because there are some differences when you talk about that. We actually do mandate all of our employees to get a flu shot annually. Okay, again, I stress a flu shot. It's a tried and true tested immunization. The COVID vaccine is under an EUA, Emergency Use Authorization. It is a different kind of authorization. We are not mandating it at this point. And I would really, again, I'm not a lawyer, but I would caution you to not mandate it because of its EUA authorization. It is not a steadfast, been around, kind of thing, and it could really create some legal, ramifications potentially for you. Again, I would always tell you to seek out general counsel advice, but I'm telling you what we are doing. We are not mandating it. We are offering it. We are educating. We are doing Zooms. We are doing everything we can with our employees to help them understand how we believe it is safe. I will say myself as a leader, I tried to be an example and got vaccinated. I had literally a sore arm that felt originally not even like a flu shot soreness. I'd be honest with you, it got a little bit more sore and it went away within 24 hours, and I've been blessed not to have any other reactions. But I do want to just go back. So that I hope that answers that question, tells you what we're doing. And Michelle, I don't know if you want to expand on that, but we are trying to do the business partnerships, get out there and support.
You got it. That's perfect.
So you'll hear a lot of good things very shortly. I know I answered that question. Did I miss any of the others?
No, you're good.
Is there anything that you were hoping to join on today that I didn't cover? Because one of the things I know I find when I'm a participant is if the speaker didn't cover the one thing I was hoping I was going to hear. So if that's the case, I want to answer it for you because I want you to leave today feeling like this was a valued hour for you.
Just out of
All right,
curiosity,
thank you.
how's the hospital doing with ICU capacity these days?
Yeah, well, thanks for asking that, Ken. I mean, it is a great question. We are, again, I feel like a proud administrator because we just really do have a great team here, and it is all about the people. Our ICU is busy. I'm not going to tell you it is not busy. Our ICU has never, throughout the time period since March of 2020 till now, reached a point of not being able to care for our patients. We have always been there. We have always been able to meet the need. I'm gonna say this politically correct. I'm not gonna tell you there aren't days that I along with my colleagues, get a little nervous because we're reaching some bed capacity. But we have never gotten to the point where we are not able to take care of our patients. Some of you may have heard and do hear. I mean, what I don't want to do is mislead you. We are not so seasonal here in Boca Raton anymore, but we do have what we call peaks where we get busier. We always joke now. We used to say we were seasonal years back when I started.
No more seasons here.
15 years ago, you could get away with saying seasonal. I've been here 15 years. Now we say busy and busier. On our busier days in season in the winter months, Kenneth, I could be normally very busy. When I sit here earlier, I kind of look at things as buckets, normal operation, and then COVID, within the hospital, because we do have 2 COVID units, and I should cover that too. People should feel safe coming here. I'm really glad you brought this up. We don't intermingle our patients. Our COVID patients are really considered a hospital within a hospital. We have 2 floors. They run on different HVAC systems. We don't even intermingle the air. And the patients are seen in different tracks in our emergency departments. And once they're identified as a PUI, a person under investigation, they're isolated. So we're very careful about it. We've never had a problem taking care of our patients. I'm again not going to mislead you. There are days I get concerned that we are reaching that point. But one of the things about being part of Baptist Health South Florida, and it's only one of the great things that has improved our hospital, is if I, as a standalone hospital here, start reaching capacity issues, not only can we potentially work with Bethesda in our market, other hospitals very close to level out that issue. We share equipment. We do anything we need to help each other out to make sure we are always here for the community and taking care of people as we need to. The one thing I'll say on here, and it's something we cringe, we never want to keep anybody waiting in our emergency department. We want to get everybody into beds quickly. But what I will say is there are times we are busy, and there are times that there are some waits in our emergency department, and there are times where we have them called, they're snow levels for us. We call them seasonal notification of overflow, where we do reach capacity, and we have to start putting people in what we call holding areas or secondary areas that aren't, up in the patient floors. It does happen in all hospitals. It happens to us in full transparency. But we do everything we can to always remember we're dealing with human life, and we're dealing with everybody with dignity and respect no matter what. We will always do that. We will always make our community the priority. And I'm very proud to say I've been here 15 years and I've never seen us deviate from that. We're busy. We're busy. But doing it safely and meeting capacity.
Brian, I have a question. It's kind of going along with Joyce asking about going outside. You mentioned that I guess you set up more tables near that lake area for people to sit. So are they wearing a mask walking out to the table, and then when they sit down, because we set up tables for our employees to eat out at lunch, 6 foot difference space. So I'm just wondering about that.
Masks, so it's a great question. Masks are required at all times on our campus, no matter who you are, except if you're consuming food. So they would wear them to the tables, and when they're consuming food, they're obviously allowed to take their masks off, and then walking to and from, they need to wear the mask.
Okay.
Even outdoors, we require it on campus. Just because of that social distancing, because they're walking together, we don't want them turning left and right, looking at each other, speaking, and having airborne concerns. So we require a mask all the time on our campus.
And as far as your condo with Joyce, I think that's a great idea to have it at 50% capacity. Obviously, I'm not an attorney, and I know their attorneys said that you should close down the pool. But in consideration that people are at home, they're not socializing, and I think it creates a little bit of a loneliness. I think it's a great idea what your condo did, which was you understand it's outside. If you do 50% capacity, there's social distancing, and I think it's a good compromise. I think that was a great suggestion that you for Joyce.
Yeah, it's been working. The last thing I'll share, because I'd like to wrap up with something very positive, morale, and you helped remind me of this, Rosie, and I appreciate you actually doing that. Stress and morale is the other people thing we should cover very, very quickly. And if you know me long enough, I'm all about reward and recognition and celebrating. And the funny thing is I didn't put that right in my note to make sure I stress this to you all. We have spent so much time making sure we are providing stress kind of relief things for our employees. We are bringing food to our employees who are working very hard. We have been blessed by a lot of great community partners who are helping at times to feed our employees and distributing meals to them. We are doing different events in our cafeteria. We've put together a coffee cart in our case that rounds in the afternoon and brings coffee to our employees for free. We put together a meal cart from 12 to 2, and actually I think we changed it to 1 to 3 a little later. If you couldn't get down during our meal periods, we'll bring food up. That's available for purchase on that food cart. The coffee cart's free. We've done, like I said, the meals with our partners where they donate things and we're able to bring those to our employees. We've done through our pastoral care, remembrances for all of our COVID patients who have passed. We realize that takes a big toll, not only on our community, but you can imagine the toll that it takes on our healthcare providers, right? So in our work environment, we went ahead and did some, remembrances so that our employees could also grieve. They're dealing with a lot of loss and a lot of different things right now. So I do want to also say, even if you're the smallest business, please make sure your team members have access to EAP and have access to different resources. They might be dealing with things in a family sense that they didn't deal with before. Again, I'm very specifically telling you, an employee in a studio unit, studio apartment, dealing with a lot of things, and even just wanting to talk to somebody about how do you think I provide the right environment for my child? I'm not a teacher. I don't know. And it's a human thing, right? So you find a friend who's a teacher, or you find somebody who knows a teacher, and you connect them and you say, hey, let's help you do that, because if we help you do that, you're going to be a better employee at work. All those things need to be taken into account right now. We should have always been kind to everybody and always had a very open and full heart. We need to do that more than ever now. So I kind of end my comments there. And Chastity, I don't know if there's anything else you want me to cover. I know we're kind of at time.
No, we're good actually. For some reason my camera's not working right this second, but I just wanted to let everybody know that a comment that Brian was making before as to whether you can require your employees to get the vaccine, and he was saying he was not an attorney. Just FYI, next month at Prime, we have Ella Leibovich. She is an attorney with Ancillary, and she's going to be speaking on, can employers require employees to get the vaccine? Find out what you need to know. So that program is open right now if you want to register for it. I think it's super important, and you will hear from an attorney who can tell you what you can and cannot do.
Thanks, Chas. Thank you, everybody, so much for being here. Brian, that was so much wonderful information. I think everybody definitely got many things out of that. So we thank you for being here with us.
Absolutely.
And we are still doing all of our Zoom events. We did a breakfast yesterday. Everything that we're doing is socially distanced, and we're following all the protocols. So when we used to do our big breakfast, now we're limiting it to 90. We'll be doing it again next month. And then next Thursday, we're doing our first Successful Women in Business Live. And again, that's going to be a smaller crowd, but you are welcome to sign up. That's going to be at the Wyndham, and you can do that on our website. I hope everybody has a wonderful day, stays safe, and we'll see you next time. So thank you so much to Brian and to Rosie, and have a wonderful day.
Thank you.
Thank you.
Chastity, feel free to share my information too. If there's anybody offline that wants any additional information or I can help, I'm happy to do that.
Perfect. Thank you.
Thank you. Excellent.
Great weekend.
Thank you so much. Thank you. Have a great day. Bye-bye.